Hello? Hello, hello. Good morning, everyone. I'm joining you again on another Saturday to go over another fun topic. Hi, Kwame. Hi, Fisho. I see we do have some people on here. Oh, hi, Amma. Um, oh, hi. Okay. Thank you for being here. For those of you who are watching who are not posting in the comment field, if you want to just put your name in there or just put a thumbs up or a smiley face, something just so that I know you're here. I do like to acknowledge everybody that is here. And for those who are not watching live, if you happen to catch this later, if you don't mind just typing in hashtag replay, that way I know that you are on here. Thank you for being here. I yes, time to go call the girls for sure. I like that. Hi, Christy. Okay, so I'm in scrubs today because I'm on call today. So I'm going to apologize in advance. If I end this abruptly, it means that I'm needed and I have to run. But I didn't want to disappoint you. A lot of people sent me messages and were very interested in our topic today, which is birth control options. So I didn't want to disappoint you. I wanted to make sure that I made it here. So hi, Kweku. Okay, so I'll give maybe just a few more minutes for a few more people to join us, and then we'll get right into it. Okay? I hope you're all having a wonderful, wonderful weekend so far and not working like me. Hi, Dr. Sutton. Thanks for being here. All right. My weekend has been a little busy so far, so if my eyes look a little bloodshot, lack of sleep will do that. But yeah, it's all for a good cause. Pull out method, good. We will address that. Okay. Hi, Ego. Yay, my big sister's on here. Okay, so last week, in following with the theme that we've been going with, we've been alternating between a GYN topic and an obstetrics topic. So last week we talked more about babies basically and how to have them. Well, today we're going to talk about babies and how to not have them. So we're going to talk about some methods you can use to try to not have a child. Our topic today is birth control options. All right, I'm going to go ahead and get right into it. I'll start by introducing myself as usual for those who know me and for those who don't know me. I am Dr. Banga, your board certified osteopathic OBGYN. Through my private practice and through platforms like this, I like to help demystify myths about the female body to help you make decisions more confidently, and through that I feel like you will be more empowered to find your voice with the knowledge that you gain through this. And for the men that are on here, once again, thank you for being here, for caring about the women in your lives. Okay, so birth control options, obviously the topic just lets us know that this is a method by which people use to not have children. I will start with the most conservative options, which would include at the very top of that, abstinence. If you don't have sex, you don't have babies. In this lecture, when I talk about some of the hormonal options, most of them will be in the framework of not having babies. I do want us all to keep in mind that hormonal medication is not only used to prevent having children. There are a lot of other reasons why we use them: irregular periods, painful periods, things like that. And that might be a lecture for another day. Again, I like to take my ideas from you. If you think that's something that you would like for me to talk about, please type that in the comments as well. But specifically today, when we're talking about the hormonal methods, we're really going to focus on using them to prevent having babies. So yes, top of the list is abstinence. If you don't have sex, you don't have children. It only takes one time for a lot of people, as we learned before. Not everybody is that lucky. But for most people, all it takes is one time to have sex to have a child. So if you're not having sex, you're not having children. I've got that out of the way. Abstinence, we know it. We know it's not very practical for a lot of people, but it is an option. Then another option that is kind of in that same family goes for people who want to try to plan out their families without the use of any medical interventions. So there's something called natural family planning. And I was born and raised Catholic. I know Catholic folks tend to encourage this method. So for those of you who don't know what that is, that's a method that really involves you being very in tune with your menstrual cycles. It also, to a certain degree, involves you knowing your menstrual cycles and having a cycle that is pretty regular. If you have irregular cycles, it's a little difficult to use this method. But once you know when your cycles are supposed to come on, and if they continue to do that consistently, then you can really track out, either by use of an app or even just by calculating around when you ovulate. If you can figure out when you ovulate, again, you can use ovulation kits. Some people can check their cervical mucus, because around the time that we ovulate, the mucus from your cervix tends to be a little thinner, a little clearer, and a little stringier. You can actually touch it and pull it out a little, and it kind of it's almost like really liquidy gum. I know that's not the best way of describing it, but once you see it once, you know what it looks like. But it has a lot of tensile strength to it, so you can pull it out, and it's very stringy. So if you can recognize when you're ovulating that way, then you know that around that time you are the most fertile. Sperm can stay in the canal, in the vaginal canal, for up to 3 days. So usually starting from about 3 days or so before your cycle, you want to either abstain from having sex or use methods such as condoms, if you want to go that route, or the pull-out method, coming to what you said, Christy. So natural family planning would involve you being very in tune with what your cycles are, hopefully having a cycle that is regular, and being able to track exactly when you're ovulating, either by use of ovulation kits, which are little sticks that you would pee on that would tell you when you're ovulating, or if you have an app that you download on your phone and you track in your cycles, you put in first day of your cycle every month, last day of your cycle, and you do that consistently, usually for at least 3 months. It can help you predict when your next cycle is supposed to come. Some apps are better than others, so you may have to play around with a few of those just to get an idea if it predicts your cycles more regularly. And if you do that, then you may be able to use natural family planning to be able to plan out your family. And that works great for some people. Percentile wise, I don't have an actual number, but it's not very high up there. It works though. At least you're thinking about it and you're in tune with your cycle. So then we go to the next step, which I kind of alluded to a little bit already. Condoms. I see there's some questions already coming through. I will, as usual, go back and answer all the questions at the end of the lecture. I'll try and get through the material first again, because I may have to run today. But okay, so next step would be, well, let me actually address what you said there. The pull-out method. The pull-out method would involve at the point at which the man is about to ejaculate, he would pull the penis out so that the sperm would not be in the vaginal vault. This involves control. This involves precision on the man's part to be able to pull out at the right time to make sure that there's no pre-ejaculate or ejaculate in the vagina. So that is actually something more for the men, but a lot of my lectures are geared mostly towards the women, so we can't really control that aspect of it. So it's an option, but not one that we have a lot of control over. It's also not exactly one that has the best success rates in terms of preventing you from getting pregnant. So yes, then we go to condoms. Condoms are devices that you would put either on the woman or on the man. There are female condoms, there are male condoms that you could put on that will catch the or prevent the sperm from making it up the female canal to go fertilize the egg. If a condom is used right, which means if it is the right size, so the man is not getting a condom that is bigger than what it needs to be, and making sure that it's not an old one that has holes in it, or all the things that could go wrong with it. If it's not been stored in a place where it has degenerated, then sometimes this can be effective as well. Some people do find that they are allergic to latex, so in that case you want to look at things like non-latex condoms. Some people do get allergic reactions to those. So if you do find that you are getting itchy and burns and a lot of discomfort with after having intercourse with somebody with a condom, that's one thing to consider. Another thing is sometimes with condoms there can be, if there's not a lot of lubrication, it can be uncomfortable as well. So sometimes you have to use lubricants, but you have to be careful because some lubricants can break down the condom and not make it as effective. So I have a chart, and I'm going to experiment again with holding up a poster for you. I worked on this week, and I appreciate all of you who called me and even worked with me on it. I was hoping to be better at it today, but we're working with a time limitation here, so we'll see how it goes. Okay, so then we get into the hormonal methods. One of the most common method that a lot of people know about is birth control pills. These come in several different forms. You can have birth control pills that have both estrogen hormone and progesterone hormone. These are the most common in various combinations. There are different kinds of progesterones that are matched up with estrogen, and some tout themselves as helping with acne and better skin, and some have estrogen concentrations that are very low. So you have things like low birth controls options. The lowest option that's available for us here in the United States has an estrogen concentration of about 10 micrograms. On average, most of them have about 35 micrograms in them. There are a lot that are around 20 micrograms as well. So sometimes, depending on your sensitivity and depending on how you respond to hormones, we may have to start with a very low dose one for you. We may have to start with a higher dose one for you. On the whole, if you do have a higher BMI, sometimes the lower dose birth control options don't necessarily work as effectively. There are also birth control options that have no estrogen in them. So for people who have chronic conditions like high blood pressure, going on a combination birth control that has estrogen and progesterone on there is not the most ideal, as the estrogen component can cause some other more severe factors like blood clots and stroke. So there are options that have only progesterone in them. Estrogen and progesterone, the way they work is estrogen hormone is what typically thickens up the lining of your uterus, and progesterone hormone is what thins out the lining of your uterus. So if you're using a hormonal method that has estrogen and progesterone in it, what it's doing is mimicking what your ovaries do. It's giving you synthetic estrogen to mimic the estrogen your ovaries make, and then it's giving you synthetic progesterone to thin out. And so you have a period, which is really a false period because you got your hormones really from the pills, not from your body. And when you're on hormonal birth control, generally, pills specifically, generally your ovaries get to rest a little bit, so they don't need to work as much. So and this is going into the alternate options for birth control a little bit. I'm veering off a little, but I'll go ahead and bring it up. For people who tend to make a lot of ovarian cysts that are painful and rupture and cause pain, one way that you can make the ovaries rest and not work so hard and make all these cysts, which they're supposed to make, is to put them on hormonal medication. So they get their hormones from the pills instead of the ovaries making them. I hope that's clear. If there are any questions about that, please post them and I'll get back to you on that. So there are pills. The big thing about pills are you have to take them at the same time every day. So they only work if you take them at the same time every day. If you vary the times with which you take them, sometimes your body doesn't know if it's going to get its estrogen or progesterone component, and you can either have irregular cycles or you can go ahead and ovulate. Your ovaries can try to work and then you get pregnant. So then it doesn't work as well. If you are going to do the option that has just progesterone, because again, you either have one of those chronic conditions where you can't have estrogen, then the progesterone hormone is the only thing that's in those progesterone pills, and that will just thin out the lining of your uterus. So sometimes if you're on just the progesterone options, you either have lighter periods or no periods sometimes. Up until about last year, most of the progesterone options were not as effective as the combination options, but there's a new progesterone option, at least here in the United States, that's on the market now called Slynd, and that seems to have just as much efficacy as the combination options. So, pills. I have a sample pack here, just in case nobody's ever seen what a pill pack looks like. Most of them come either in a circular form or in a rectangular form like this. You typically have about 3 weeks of active pills, and you either have the 4th week being all just, we refer to them as sugar pills or placebo pills, so they don't have any hormones in them, or there could be different combinations. This particular one has only 4 days, so you're allowed to have just 4 days of a period. So for people that have very heavy periods, this would be a great option because it limits how many days they would have a cycle, and thus they have better control. And it's marked by days at the top, so most of them typically start with a Sunday, and that way you know that you didn't miss a pill. But again, with these, you want to take them same time every day, ideally. Okay, so next, another option for birth control would be an injection. So there's an injection called Depo-Provera that you can get once every 3 months, not every 6 months like somebody on here, I'm not mentioning any names, did. Once every 3 months, and so that's just 4 times a year. So you get, it's only got progesterone hormone in it, so no estrogen in there. Typically, most physicians will have you come into the office to come and get the injection, so you can pick it up at the pharmacy and bring it in and get your injection every 3 months. Because it has just progesterone hormone in there, a lot of times some people have no periods on it. One of the things about progesterone only options, remember I said it thins out the lining of your uterus, is if it does that, then there's nothing to shed, but sometimes it can overdo it a little bit and you can have some irregular bleeding. We can always, your OBGYN, your friendly OBGYN can work with you to try to regulate that a little bit. So Depo-Provera is an option that is great for people who know that they're not going to remember to take a pill at the same time every day, and they don't want to have to do something every day anyway, or even every month, because you only have to worry about it 4 times a year, which is every 3 months. It's very effective, and especially if you're going into your physician's office to get it administered, then the risk of you administering it wrongly is very low. In between that, you have an option called the NuvaRing, and this is what that looks like. It is a little synthetic device. you would squish it up and place it vaginally, and it stays in the vaginal canal. One of the most common questions I get about this is, what if it gets lost in there? So the vagina is not a never-ending canal. It doesn't just go on and on and on. It is a blind-ending canal. The cervix is at the top of the vagina, and the opening into the cervix is pretty small. So this cannot be sucked into your uterus. It sits in the vagina. I typically will recommend that if you are not comfortable using a tampon, you're not comfortable putting something in and out of your vagina yourself, this may or may not be the right option for you. If you're comfortable putting in a tampon, then this is quite easy because it's the same concept. Squish it up, place it either in a squatting position, a sitting position ideally, and it is pretty flexible, so it stays right there. It can stay in during intercourse, and that's one less way to forget to put it back in. It usually stays in for up to 3 weeks. You take it out the 4th week, you get your period. You put another one back in. If you get more than one prescription at a time, do remember that the others have to be kept in a cool environment. So you can even put them in a refrigerator to keep them nice and cool, so they are denatured by heat. So that's the NuvaRing option. It does have both estrogen and progesterone. So again, mimics the ovaries, so it can suppress the ovaries a little bit. Then we have the option of the patch. So the patch is and I see more people joining on here. Hi, Kukua, thank you for being here. Okay, as I mentioned this at the beginning, and I'll say it again. If you're on here watching, if you don't mind, just drop a hi, a hello, a smiley face, just so that I know that you are on here. I like to acknowledge everyone. And if you're watching this on replay, if you don't mind just typing in a hashtag replay, then I know that you are on here as well. And then I know how to send more information to you for upcoming talks. Okay, so next up, so we've talked about abstinence. We've talked about natural family planning. We've talked about condoms. We've talked about the withdrawal method. And now we've talked about pills. Wow, we've talked about a lot. We've talked about pills. We've talked about the Depo-Provera shot. We have talked about the NuvaRing. Okay, so next, another option would be the patch. So the patch is it looks like a little Band-Aid, tiny little Band-Aid. So you stick it on, ideally somewhere where you have some flesh. For me, that'd be my belly. But you would stick it right on an area where you have some flesh. And you can alternate where you put it. You put a new patch on every week for 3 weeks. And then the 4th week, you leave it off. And then you have your cycle. I recommend putting it somewhere where you can see it, so that it doesn't come off and you miss seeing it. And like I said, I recommend alternating where you put it. It's also pretty effective. It's sort of in the same family as the NuvaRing, because you don't have to do something every day, but you do have to do something a couple times a month. All right, so those would be some of your shorter term birth control options, things that you do either on a daily, a weekly, a monthly, or every quarter basis. Next, we start going into options of longer term birth control options. So one of those would be something called a Nexplanon. You may have seen commercials about these on TV with women standing up like that. And that's because this is an implant that goes in your arm. So it's a little rod-shaped device. I brought my little sample of it here. It looks just like that. Not this color. I think most of the ones I've seen are white. But it comes in a little device that looks like it's a little device with a cord out bore needle. We numb up an area in your arm. We map it out carefully to make sure we avoid where your nerves are. and we put it in an area that's not too irritating because it doesn't rub against your the side of your chest too much. And we numb up the area first with some numbing medicine, and then we inject it literally under the skin in your arm, so you can actually feel it in place, which is reassuring to some people, and it's a little odd to other people. This device also has just progesterone in them, and sorry, I should have gone back. The patch has estrogen and progesterone. So the Nexplanon has just progesterone in there. It can stay in there for up to 3 years. You don't have to do anything about it. Once we put it in there, that's it. You are good for 3 years. Because it has progesterone hormone in it as well, it does have that tendency sometimes to cause some irregular cycles sometimes. And some people have no periods with it. Everybody is different. Everybody responds differently to hormones. I get a lot of people asking me about weight gain, about mood fluctuations. I could put 2 people on the exact same medication and they would have different responses to it. There's no test to figure out how one person will do versus the other. So some of this does sometimes, unfortunately, end up being trial and error. So, all right, so there's the Nexplanon. You've seen what it looks like. Little rod-shaped device. I think this is showing up better than my poster, so I'm going to save the poster to the end in case it's not showing up as well. And it's good for 3 years. It's got progesterone hormone in there. Then we get into the one that I think most of you have asked me about the most. Most of you have asked me about the most. IUDs, intrauterine devices. These are devices that we put inside your uterus for prevention of pregnancy. And, of course, I have one to show you. So I'm going to pull this one out. So this is what they look like. And they have strings at the end of them. Can't see the strings too well. They do come in a little rod-like device that we use to place them carefully inside your uterus. And this is my makeshift uterus. Actually, the company gave this as a model. So this is your uterus. Your uterus is almost like a T shape. So this fits perfectly like that if it's placed appropriately. It should never be shoved in place. And depending on the one you get, it's good anywhere from 3 years to 10 years. And I'll go through those a little bit. The 3-year ones generally are a little smaller and probably ideal for people who have never had children before. With the exception of one of them, all IUDs mostly have progesterone hormone in them. There's only one that has absolutely no hormones at all, so I'll get to that. So we put it in the office. This has to be placed in the office, and it's good for anywhere from 3 to 10 years. The smallest one is good for 3 years, and it can be put in people who have never even had children before safely. Most of them are good for anywhere from 5 to 7 years. There's some that are good for 5 years that have varying amounts of hormone in them. You can have as little as 19 micrograms of hormone to as much as 52 micrograms of hormone. Because these are all progesterone hormone, the varying amounts of hormone will also have effects such as what your periods do. If you have more hormone in there, most likely it's going to thin out your lining more so, and you won't have periods as well. The way the IUDs are supposed to work to prevent you from having children is this. The strings stick out of the cervix and they thicken the mucus of the cervix. In one of the previous lectures, we talked about that. When it thickens up the mucus of the cervix, sometimes that makes it harder for sperm to make it through. Then, once the super sperm make it through that thick cervical mucus, it has to maneuver its way physically around the IUD inside the uterus. So that's another area where it can block pregnancy from occurring. In one of the more previous lectures, we talked about the egg and the sperm meet in the fallopian tube. So sperm has to make its way through the inside of the uterus into the fallopian tube to meet the egg. So let's say it manages to dodge its way around and, make it into the tube to meet the egg. The two have to now make it back into the uterus and find a nice fluffy bed to implant in. If you have an IUD that has progesterone in it, progesterone hormone is thinning out that lining. There's no nice fluffy bed for anything to implant in. So that's a third way it can prevent you from getting pregnant. So you have the block at the cervix with the mucus, you have the physical structure, you have nowhere for it to implant. So several ways that it can do that. One thing that happens is once we place it in, the strings are pretty long. We do tend to trim the strings. This is, hi Nanama, hi Victoria. This is an important part of an IUD placement, because if the strings are cut too long, then sometimes that causes discomfort, either for the person it's placed in, so the woman, or for their partner during intercourse, because sometimes it can feel like it's poking. Sometimes it's all in the head. Sometimes if you know that there's something there, you can imagine it poking. So I always like to differentiate between the real discomfort and the imagined discomfort. But realistically, it can poke. So if it's cut too long, then sometimes that can cause some discomfort. If it's cut too short, however, then when you're looking for it, sometimes it's a little more difficult to get out if the strings are really short and they can't be seen very well outside the cervix. So when it's initially placed, it's not unreasonable to cut the strings a little longer. I get people asking me, cut it really short. I don't want my partner to feel it. Well, you don't want me to cut it too short initially, because usually you should come back within a few weeks to be rechecked. And at that point, if there's a need to be trimmed, that would probably be a more ideal time to trim it. Because if you cut it too short initially and it settles further inside the uterus and now we can't see the strings, then when it's time to take it out, we may have to use a few more instruments to pull it out than can be comfortable for you. Because we have to locate the strings that are now hiding in the canal. So ideally, part of the strings should still stick outside the cervix. Over time, it tends to curl behind the cervix and hide, so that, yes, you can put your finger in there to feel to make sure that it's still in place. A lot of times you can't even feel it if it's curled around nicely enough. If it is not in a position where it's comfortable for you or for your partner, certainly talk to your OBGYN about it and come up with the most ideal way. Make sure that the strings are cut, but not too short to where they cannot be easily seen. One of the, and I'm going to spend more time on this because this is the one I got more questions about. Well, the man's didn't touch the IUD. I'll get to the questions in just a few minutes, but yes. That's funny. I will get to that. That actually did just distract me, so I'm going to go ahead and just address that question. Depending on how the cervix is positioned, sometimes the cervix is positioned right midline. So yes, if a penis goes right in, it can touch the cervix. If a cervix is positioned posteriorly or anteriorly, then it doesn't touch directly. So theoretically, yes, the man's penis can touch the cervix, and if the strings are sticking out, it can touch it as well. But it doesn't pull it out unless there's a hook on the tip of the penis, which I don't see a lot of penises, but I'm yet to see one that has a hook at the tip of it. So yes, it can touch it, but it won't pull it out. These strings are pretty thin for anyone that knows what fishing wire is like. It's similar to that. So it's not barbed. It can't catch onto things and pull out generally. So when it curls behind the cervix, it's usually pretty smooth, so it doesn't get irritated. Okay, it says question answered. Okay, all right. I hope that answered some of the questions. The main ones I got were about the strings poking. If the IUD has been in place, especially if it's been in place for more than 6 weeks and it's continuing to cause pain because the strings are poking both yourself or your partner, then yes, certainly go back for follow-up and see if the strings can be trimmed. But ideally don't ask for them to be trimmed so short that they cannot be seen, because when it's time to have that IUD taken out, that's when you hear stories about it was so painful to take out, and that's because we did have to maneuver a little bit to find the strings. It's very, very rare for an IUD to be placed and get lost. It's possible for the strings to get coiled up inside the cervix to where we may have to fish them out a little bit when we're taking it out. If you were to go on the internet, it seems like every week somebody is posting something about the IUD migrated into the bowels, or was stuck inside the uterus and was unable to be taken out. I'm not saying that does not happen. It's just not very often. And you have to think about different people's anatomy. You have to think about it was the difficulty placing it initially, were there fibroids in place? Why was it placed in the first place? You know, there's a lot of things that go into that. So when you read some of these stories on the internet, just take it with a grain of salt sometimes. For most of us who put IUDs in, a lot of times they come out quite easily as well, and people do great on them. All right, so thank you, Cynthia. Okay, so let's see. I did fail to mention one birth control option, and I apologize for that because it should be given some credit too, and that's the cervical cap. So this is a flexible cup that can be placed to cover up the cervix, to also obviously prevent sperm from making it through. It's not the most convenient. The main one that I tend to use is a brand called Kaya, and it does take some pre-planning, so you do have to put it in place at least 30 minutes before intercourse, and you can sometimes put spermicide in it. It does have to stay in place sometimes for up to 5 hours after intercourse, so it does take some spontaneity away from the use of it. But if you're a planner, then this might be a great option for you, and it has no hormones, so that's the ideal part about it. Okay, so with IUDs, we talked about all the progesterone ones. We talked about the ways that they work. And we also talked about the fact that there's one that has no hormones in it. So that particular one is called Paragard. There's only one, so I won't be discriminating if I use its name because I didn't mention the competitor. But Paragard is an IUD as well, intrauterine device that we can place in. It has no hormones in it. It is made out of a copper device, which creates an unfavorable pH inside the uterus for implantation and fertility. So it also has strings that stick out the cervix, so thickens up the cervical mucus. It has the physical structure inside the uterus, and even though it doesn't have progesterone, so it doesn't thin out the lining of the uterus, it is made out of copper, and that doesn't create a favorable environment for a baby to want to grow. So there are a few exceptions to people that should, a few groups of people that should not use the Paragard, and specifically people that have a condition called Wilson's disease should not use it, where they get deposits on their liver. With all of these birth control options, it's not just a one size fits all. Everybody has certain physiological things. Everybody has certain characteristics that, or certain lifestyle or health issues that may make them more ideal for one particular birth control than another. So that's where your OBGYN comes in, or your family practice doctor, to go over your health status and figure out which birth control option would be the most ideal for you. Be honest with yourself. Be realistic. If you can't take a pill same time every day, don't try it, because it's not going to work. There's no point to it. But if you think you can set an alarm on your phone, an alarm by your bed, put it by your toothbrush and take a pill same time every day, great. If you don't think you'll find the time off from work 4 times a year to go in and get a shot, then don't go that route. But if you can, great. If you can't put in a tampon, then maybe don't try the NuvaRing. If you'll forget about a patch on you, maybe don't try that. Maybe look at something more long term. But there's a lot of different options to help us plan out our families, ranging from options that have no hormones to options that take advantage of our natural body physiology, like the natural family planning. Okay? All right, let's look at questions. So, and thank you again, everyone, for being here. All right, questions. Time to go call the girls. That makes me laugh. Good morning. Pull out method, good. So pull out method is good. It's only as good as the person that's pulling out in their self-control. Okay. Let's see. And actually, maybe I will trial my poster to see, because I do have some percentages of, how effective the different ones are. Okay. Thank you for tagging your friends. I really appreciate it. Yes, please, if there's anyone you know that you think would benefit from this, let them know. Some birth control medications have been associated with breast cancer and fibroids. True. Yes. Okay. So, yes, like I said, we're talking in this lecture about birth control or hormonal medications specifically for prevention of birth control. There are some side effects with all hormonal medications. One of which is an increased risk of breast cancer. So if you have a family history of breast cancer, if you have a personal history of breast cancer, you may want to, especially if it's a breast cancer that was estrogen sensitive, you may not want to use a hormonal option that has estrogen in it. But we have other options that have no hormones in them. Fibroids, as we talked about in one of our previous lectures, do tend to grow in environments where there's a lot of estrogen. So yes, if you want to avoid exposure to more estrogen, you might want to avoid a hormonal option that has fibroids in there. That being said, fibroids do tend to also cause heavy bleeding. And sometimes the treatment for the heavy bleeding associated with fibroids could be hormonal medications to regulate the lining of the uterus and thin out how much shedding there is. So hormonal medications can help and worsen fibroids. It's a bit of a tricky balance depending on how big your fibroids are, where they're located. For example, if you have fibroids that push on the inside of your uterus, you may not be a good candidate for the progesterone IUDs, even though those could sometimes really help with the bleeding from the fibroids, because they're pushing on the inside of the cavity, so they distort it and your IUD can't sit there in place. It also depends on how aggressive you want to be about your fibroids. Are you willing to consider surgical options, or do you want to do something more temporal until you get to menopause? So there's a lot of factors that go into whether or not hormonal methods are ideal for fibroids. But specifically for breast cancer, which your question addressed, yes, the estrogen component can sometimes be a problem. There are breast cancers that are also progesterone sensitive. So in that case, for birth control, you probably would want to use one of the non-hormonal options. Okay. It works if your cycle is regular. Okay, I've used it. It works. And hello. I see a lot of people on here. Thank you again for being here, my amazing sister. I won't be comfortable with that because I've never liked tampons. Yes, so it sounds like you're talking about the NuvaRing. Yes, if you're not comfortable with tampons, then, and it's mostly because of the idea of putting it in and taking it out. If you are comfortable with it, squish it up, put it in, and when you're taking it out, literally take a finger, put it up in your vagina, hook it, and pull it right back out. There you go. It can stay in during intercourse. If you don't want it to, you can pull it out. Just make sure that it doesn't stay out for longer than 3 hours. Rinse it under tap water, put it right back in. If it's longer than 3 hours, put a new one in or you'll get pregnant. Hello. Outstanding. Thanks, Dr. Sutton. You're amazing. I like watching you. Dr. Vance. Oh, the months distant touch. I think I addressed that one already. Did the female condom ever catch on? It comes in waves. The type of people that would be, I think it's a personality thing. It's what I tend to see. The type of person that would be proactive enough to want to carry around her female condom will definitely remember to use it every single time. And if you are in a relationship where it's mostly a female couple relationship, then yes, that is something to consider. My soapbox moment. Birth control prevents you from getting pregnant. It does not prevent you from sexually transmitted infections. The only thing that prevents you from that are abstinence and condoms. So, yes, you can use these to prevent yourself from getting pregnant, but to prevent yourself from getting a sexually transmitted infection, abstinence or condoms. Okay. And what about smoking and types of contraception? Okay, great question, Dr. Barnes. Okay, so if you are female, you are over the age of 35 and you are a smoker, do not use especially estrogen containing birth control because that can cause strokes. Smoking just generally has so many adverse side effects. But yes, specifically with a female over the age of 35, I'll go ahead and throw in higher BMI as well. Then your risk of blood clots does go up higher. So there are some exceptions for all the different kind of birth controls for people that can use them. Breast cancer, fibroids, smoker, age. But as we can tell, there's several different birth control options. And so there's a lot of people that can find. All right. On that note, I see that I may be getting a call, so I'm going to go ahead and jet. Thank you for being here. Once again, I'm Dr. Banga, your board certified OBGYN, here to give you knowledge and power through information and demystifying myths. I hope you learned something from this. I will be here again, same time next week, 11:30. Please send me suggestions as to what you want me to talk about. It should be, next week is going to be an OB topic. I will send an announcement by Thursday. I'll post an event on there. I really appreciate you being here. Have a wonderful, wonderful weekend. You can find me on all social media under Dr. Banga OBGYN. So that's DRBANGA OBGYN. Thank you. Bye.